Hello, this is Dr. Stanley Lang, and welcome to this broadcast. I have a question for you. What do you think is the best way to have balance in exercise, and how does that balance in exercise affect your stress level? So, when I say balance in exercise, I mean balance between how much time spent per day, and also balance between strength, aerobic, and flexibility exercises. So, what is the right balance when you consider wellness and stress management, stress reduction as your goal? So in the larger context, we're approaching this question trying to look at it from a whole person health perspective. And in the whole person health perspective, we look at it from physical, emotional, and spiritual sides. And today we're focusing on the physical side, and that is particularly with exercise. So basically, I think that it would be helpful for you, since you're not exercising regularly yet, to consider what the end is going to be, and then to sort of figure out how am I going to get to that end point. So the end point that I would suggest to you as a family doctor that's seen a lot of patients over the years go from a place where they're not exercising at all and they're moving to a place of trying to get in a lot better fitness is to have these three different kinds of exercise properly balanced in an average week. So first of all, I want to say that I want to suggest that flexibility or stretching exercises should be part of your daily routine. Now, there's a lot of reasons why that should be, including the idea that it helps you to relax, but it also helps your muscles be a lot healthier as they work out the tightness that is part of how most people live. So I think that having a target of having daily flexibility is a good strategy. How long to do stretching? I think a minimum amount of time is about 15 to 20 minutes. If you cut it much shorter than that, you really are making the exercises much less effective than they can be. In another video, I've gone into a lot more detail on how to stretch effectively. Now, can you benefit from 5 minutes of real brief stretching? Sure, but we're talking about what's the ideal for as far as balance at this point. The second area of exercise is what we'd call cardiovascular exercise. Now, you've heard the term aerobics before, and aerobics was popularized in the 70s by Dr. Kenneth Cooper from the Cooper Institute, and at that time aerobics meant sustained continuous exercise, trying to hit a target rate of about 70% of your maximum heart rate and sort of keeping it there for the whole time, more or less. Now, there's a lot of variations on what that means. Some people talk about aerobic dance, and when people talk about aerobics, so to speak, they're usually referring to some sort of a dance routine or a series of calisthenic dance routines. But aerobic exercise traditionally was applied more to the concept of continuously running or vigorous walking or exercising with a bike. And the idea was to sustain the heart rate for at least 20 minutes and preferably 30 minutes during that whole time, and that would induce all sorts of good physical effects for you. So if we're focusing on aerobic exercise as it's been traditionally understood, then the goal is to have at least 5 workouts per week. Now, why do I say 5? Well, because of some research done more than 20 years ago that looked at American physicians who exercised 5 days a week or 4 days a week or 3 days a week, etc. And what they discovered is that 5 days a week was kind of the optimal in terms of heart disease reduction. And for each day that they took away from their weekly exercise time, they lost about 10% benefit. So people that exercised 5 days a week had about a 44% reduction in heart attack rate. And then if they had 4 days a week, that's about 33% reduction, etc. So about 5 days a week is a pretty good target for most people. And then since the last 10 years or so, there's been a lot of adjusting to the concept of what's the best kind of cardiovascular exercise, and should we still be doing plain aerobics where you just stay at that same intensity for the whole workout, or should you be doing something that is more like what would be called interval training, where you're pushing yourself as hard as you can, and then you're backing way down and recovering, and then you repeat that again, sort of like somebody running a 100-yard dash 10 times in a row. So at this point, I'm not going to go into the pros and cons of the two different types of cardiovascular exercise, just to say that you should be exercising if you're doing it the traditional approach, about 5 days a week, and it's particularly if it's a vigorous walk as your goal. If you're doing the more intense interval training, 4 days a week is probably sufficient. And then finally, the thing about strength training, and this is the one that people really don't like to do because it's just not fun for most people, and most people just don't have a fun workout. But the goal is to do a head-to-toe strength program 3 days a week, and doing it less than that, you just don't get the muscle building effects for your body that you can get with 3 days a week. Now, why do you want to combine these three things together? Well, if you do cardiovascular training by itself, you're going to isolate some muscles and get some of them into pretty good shape. Others are going to not get into that good a shape, and you will start to get some imbalances in the muscles throughout your body, and that eventually leads to a lot more symptoms as people get older, and imbalance issues that can be completely fixed if you're in a completely balanced strength exercise program. So by strength exercise program, I don't mean lifting heavy weights. I mean lifting a good balanced set of weights that strengthen all opposing major muscle groups. So I'm not going to get into the details of how to do that, but I want you to think about how you could integrate a 3-day-a-week strength exercise program. So what might this look like in practice if you have sort of a moderate amount of time that you can have, or a less than moderate, let's say a minimal amount of time. Let's say that you've got 30 minutes a day that you can exercise more vigorously. So what you could do would be to have a cardiovascular workout 4 days a week and alternate that with a strength workout on the alternate days, so that you're doing something every day. And if you do that kind of a strategy, it's going to really help you to be in good fitness. It's going to help your muscles be as healthy as possible. You'll be in balance, and it'll be a tremendous asset towards stress reduction. Then, if you reserve the flexibility exercises to be something that you do immediately after whichever type of exercise that you chose, and to try to do that as a way to relax, to sometimes even pray is a good way to enter into that flexibility time. And if you can't do the flexibility exercises immediately after exercise, which is the best time to do it, then later in the evening, just before you go to bed, do some gentle stretching, and that's a great way to relax your body, a great way to decrease the stress that's affecting your body, your mind, and your spiritual life. So I encourage you to start someplace, and the someplace is usually a cardiovascular workout of some sort. So a vigorous walk 5 days a week, that's a great place to start. And then move forward with these other strategies, with having the end in mind, knowing where you want to go in terms of the flexibility exercises and the strength exercises being part of the big picture. And with this approach, you can fit it into most schedules. I've myself had to do this, and I have a pretty busy schedule, and I've helped a lot of patients figure out how to include this kind of a strategy in their pretty busy schedule. If it's high priority, it will happen for you, and if it's not high priority, you'll find a million excuses. So my encouragement to you is that it's one of the most powerful ways to be healthy, one of the most powerful ways to decrease chronic stress effect on your life. So if this has been a helpful encouragement, I ask you to share it with friends and family, and also to subscribe to this channel for future updates on how to stay healthy in body and mind and spirit. Have a great day, and God bless.